Hi guys, my name is Milan Collins and I will be presenting Population Level Health Education Intervention presentation for Nursing 49612. So introduction. The two main health issues in Inglewood, California's underserved area are obesity and heart disease. So obesity is actually becoming an epidemic in the United States, and heart disease is the number one heart attacks that are killing Americans. Background and significance. According to the American Heart Association, people with a BMI or body mass index of 30 or higher are considered obese. Nearly 70%, which is more than half of the American adults, are either overweight or obese in 2014. And being obese puts an individual at higher risk for health problems like heart disease, stroke, diabetes, high blood pressure, hypertension, and more. While doing my windshield survey assignment, I noticed a lot of people in the underserved community of Inglewood were either overweight or obese, and they were coming out of a lot of fast food restaurants like Fried Chicken and Popeyes. So another health issue in the underserved population is heart disease, and cardiovascular or heart disease, listed as an underlying cause of death, accounts for nearly 801,000 deaths in the U.S. Just about 92.1 million Americans are living with some form of cardiovascular disease. And heart disease can be caused by smoking, physical inactivity, nutrition, overweight, obesity, high cholesterol, hypertension, diabetes, and more. I work at Sentinel Hospital Medical Center, and many of our patients have lower income, lack of education, lack of resources, and over 90% come in with some sort of heart disease or underlying cause. So according to the Healthy People 2020 objectives for obesity, three that I chose that stood out to me were the main ones, and it is to ensure that all Americans eat a healthy diet, participate in regular physical activity for at least 30 minutes a day, and achieve and maintain a healthy body weight at every age. So regardless if they're 2, 20, 40, 80, 90, to be participating in healthy behavioral patterns. Another objective is to prevent inappropriate weight gain in youth and adults, and reduce consumption of calories from solid fats and added sugars in populations aged 2 years and older. Obviously, they picked 2 years before because most of them were probably breastfeeding or on some kind of formula beforehand. So heart disease 2020 objectives, again, I picked three main ones that stood out to me. It is to reduce the portions of persons in the population with hypertension, increase the use of aspirin recommended among adults with no history of cardiovascular disease, so to a certain age, to prevent any heart attacks or strokes. Increase the portion of adults with elevated LDL cholesterol who have been advised by their doctor regarding cholesterol lower management, like lifestyle changes like physical activity or diet, and if indicated, medications like maybe simvastatin or Lipitor. So this is all sourced from Healthy People 2020 objectives in 2017. So needs assessment. To gather vital information and data, I interviewed a key stakeholder at Centinela Hospital Medical Center and a member of the community. The windshield survey completed in the underserved community definitely revealed a lack of resources like health educational classes, lack of knowledge and understanding, lack of healthy food options, and lack of health insurance. So on the right, I saw this community health needs assessment process map, which I found really helpful. It kind of has the key aspects of data collection implementation, identifying, prioritizing the health needs, and implementation strategy development. So those are kind of steps you can take to determine your needs assessment. Theoretical framework. So throughout this course, we've been talking about the proceed model. And according to Community Toolbox, it is a community-oriented, participatory model for creating successful community health promotion interventions. It does embody two key aspects of the intervention, which include planning and evaluation. So a logic model provides structure for constructing the intervention and definitely a framework for critical analysis. It assures for community involvement and allows for leeway to adapt the context and methods of the intervention to a particular needs and circumstance of the individual. So not just, the individual they focus on, but they also focus on the community. So everything together, it involves everyone. The proceed portion does have 5 phases. It does consist of the actual intervention, and the proceed portion has 4 phases and consists on implementation and evaluation of health intervention. So also continued, we are going to talk about the 5 phases of the precede model and the 4 phases of the proceed model. So the first phase is social diagnosis. And what does the community want and need to improve its quality of life? So lack of resources, we want to have more community resource centers for help, maybe insurance-wise. Phase 2 would be epidemiological diagnosis. What are the health issues that are clearly influence the outcome of the community? So in Inglewood's case is heart disease and obesity. There's also other issues, but those were the 2 main issues that really stuck out to me. Phase 3 is behavioral and environmental diagnosis. So what behaviors and lifestyles and or environmental factors must be changed to affect the health or issues of the community? So, lack of resources, lack of knowledge, lack of health insurance among these residents in the population, unhealthy lifestyle, lack of proper diet and exercise. Many of the people were coming out of, fast food restaurants. They came out of liquor stores with bottles. There's a lot of homeless people over there. So that would be considered phase 3. And phase 4, I'm sorry, that was phase 2. So phase 3 is phase 4 is educational and organizational diagnosis. So what are the predisposing, enabling, and reinforcing factors that access for the barriers in phase 3? What are the enabling factors? Like Sentinel Hospital. Phase 5 is administration of policy diagnosis. What are the internal administrative issues and internal external policy issues that can affect the successful conduct of the intervention? So the proceed part is all the intervention. Now we go into the, now we go into proceed model, which is phase 6. Phase 6 is implementation, and that is carrying out the actual intervention. Phase 7 is process evaluation, determining whether the intervention is going to as planned. Phase 8 is impact evaluation. So determining if the intervention is making the desired impact with the targeted population, evaluating, on the behavioral, environmental factors it aims at, or do we need to adjust accordingly? Mostly these are impact evaluations are like short-term objectives and goals. And then phase 9, which is outcome evaluation, these are long-term objectives. Evaluate whether the intervention affects our in proceed outcomes of the community identified in phase 1, which was starting of the intervention, and do we need to adjust accordingly? So this is all sourced from the Community Toolbox of 2016. And then next we have issues, education, and practice. So strengthening vulnerable populations and communities, that is a little chart on the left side, and it consists of low-income residents or households, refugees, immigrants, and internationals, military veterans, older adults and their caregivers, build capacity of community organizations, and strengthen and develop community leadership. I found that on the internet. Obviously, they are missing some vulnerable populations, but it's just kind of like the basics on how to strengthen the population and the community. So these interventions were based on providing knowledge to the underserved targeted community of Inglewood. And the population definitely has to have the knowledge given to them so that they can decide on making the healthy change. And obviously they can't be forced to do it. They have to do it on their own. Change happens by one person. You can't change someone themselves. So nursing health and communication resources to affect change, including education, community events to raise awareness, clinics, and more. So assets of this population include already being part of a senior fitness program, which provides physical activity, educational classes, and of course support, which is huge. Barriers for this population include a lower income area with lack of knowledge, lack of resources, and lack of healthy eating options. I did see a lot of fried food places, Taco Bell, Kentucky Fried Chicken, Popeyes. Many people were coming out of those, and most of them were obese, and I'm sure they had other underlying conditions. So interventions. I taught 2 educational programs to the seniors at El Segundo Athletic Club, which is known as the Silver Slipper Program, which is by Team CJ Fitness. My educational technique is obviously I do like to have positive vibes, positive affirmations. I like to encourage expression for concerns and provide open-ended questions to share the thought process and experience. So I did have a lot of participants who asked a lot of questions. I personally like visual aids and I learn from those the best, so I decided to use pamphlets, and I also like videos and PowerPoints, obviously not too long so you don't want to lose their attention, and I presented it on ways to decrease overweight and obesity, increase physical activity, nutrition, cause of heart disease, and recognizing the signs and symptoms. On the right side, I used causes of heart disease, that chart, and I put it in one of the visual aid pamphlets. So it kind of talks about diabetes, aging, genetics, lifestyle, gender, smoking, diabetes. So some of the causes. Obviously, my intervention was definitely revolved around the Healthy People 2020 goals and objectives. I made sure my teachings were focused on that. So budget and logistics. On obesity, both obesity and heart disease took less than $10. It was fairly easy, very cheap. It was very time consuming, but cost-wise, it was very affordable for me. So obesity, I printed out handouts and pamphlets. I just kind of put on vital information, what to do to help lose weight, statistics on obesity in the United States, pictures. That was only $2.50. So because we were already in the gym, I was able to use a yoga mat and light weights. I also have that at home, so it didn't cost anything. And I showed a little routine exercise, what you could do every day, whether you're in the gym or whether you're at home. At any age, someone can do just 30 minutes a day, that's all it is. Also, I showed a YouTube video, which I found very interesting. It was actually the size of muscle versus fat. So when people say, well, I only lost 5 pounds, 5 pounds is a lot. It's huge versus 5 pounds of muscle, or even 1 pound. And that didn't cost anything. So the total cost for obesity was only $2.50. On the other hand, the heart disease, the printing out handouts and pamphlets, that was only $2.50, the same. PowerPoint presentation on the causes, signs, and symptoms and ways to avoid heart disease was nothing. I also provided an example of a healthy snack, which can go both for the obesity and heart disease as well. An apple and almond butter, it was only $4. If you go to the 99-cent store, you can get them for $1 each, even peanut butter. So that total cost was $6.50. So it's very affordable. It's under $10 for everything, except it was time consuming. All right, so outcomes and measurements, short-term goals and long-term goals. By the end of the health education classes, at least 60% will give 3 examples on ways to prevent obesity. Now, mind you, there was only a class of 4 and 2, so it wasn't a very big class. 80% will give 2 examples of the causes of heart disease, which they did. Everyone will be able to take their own blood pressure using automatic machine and understand the healthy value ranges. So I did provide, which I forgot to say, an automatic blood pressure cuff. I had everyone take it, and I educated them on the systolic and the diastolic meanings of it. So Also, half the class will be able to give examples of a healthy meal, like breakfast, lunch, and dinner snack, like, the apple and almond butter. At least 50% will initiate healthy diet choices and follow a well-balanced diet. 100% will leave with extensive knowledge on obesity and heart disease. And by the end of the class, 60% will make changes to their lifestyle for better health and well-being. Those short-term goals, I'd say about 90% of them were met by the participants. They were already on their way because they were in the Silver Slipper program to changing their diet and following a healthy lifestyle. So long-term goals. Obviously, these long-term goals, some of them you have to go back after a month or even up to a year. So the population who attends will gain the knowledge, skills, and positive attitudes in healthy behavior and patterns. This was definitely met. 1 month after the health education classes, at least 50% will adhere to healthy eating habits and continue physical activity. This was also met, and at least 50% will continue on with the health education by attending several classes offered by community resource centers like recreational centers or the library. And at least half the class will be active in their health and well-being by continuing having yearly checkups with their primary care physician. Now, this long-term goal would have to be after a year. So you'd have to come back after a year and see if that was actually met and to see if actually people stuck to the program. Results and conclusions. So the main points. I believe this overall class was very eager to learn. Many actively participated and asked questions, and all was super appreciative that I actually came and took my time to educate them. They were very happy about that. Well, some weaknesses and problems is that besides those already in the Silver Slipper program, it was really hard to gather outside participants. There's only a total of 4 people in class for the first one and 2 people in the second one. Unfortunately, this program only offers for 65 years and older, and it is covered with insurance or a low monthly cost, I believe about $25 a month. But you get classes and educational and workout programs, one-on-one fitness centers, so it's a pretty good deal. And also, because of the population, I did have to repeat myself a couple times in a loud tone voice because they're hard of hearing. So that is it. I hope you guys enjoy it.